right. Karibuni. Welcome back to the OneMic Show. Na ni furaha kujiunga nanyi wapenzi wasikilizaji, tukiwa tumekuandalia taarifa za kusisimua, muziki wa kata viungo na kindumbwe cha siasa politics ukipenda. We are streaming live on Facebook from Kilimanjaro studios outside Washington DC, and we're also live on YouTube, so please call in also your YouTube friends. Please remember to subscribe to both our YouTube and Facebook pages at the OneMic Show, and you can follow us on Instagram and TikTok. We're also taking in live calls tonight, 202-683-4570. Press star 5 to speak. The number to call is 202-683-4570. Press star 5 to speak. Now, across the Kenyan diaspora, many of us still believe that food back home is more natural and organic. But as diabetes, cancer, and other chronic illnesses continue to rise, that belief is being challenged. Joining us shortly from Houston is registered nurse and CEO of Healing Bridges Infusion Specialists, Christine Ouma. She'll help us examine the connection between Kenya's food system, lifestyle diseases, and the growing influence of Big Pharma. So the big question for tonight is Kenya's changing food supply making our families sick? We'll also talk about the highly anticipated KNAA conference this September 17th to 19th in Baltimore, Maryland. So keep it locked and start dropping your comments below. Let us know where you're tuned in from, what city, what state, what country. Na bila kusahau, napokea mziki toka DJ wetu machachari, mleta habari DJ Moshfire, na tutadunda kule viwanjani na Mika Oje zake namba 7 mgogoni, akilotea habari za michezo. Na moja kwa moja toka Kilimanjaro studios ni mimi mtangazaji na mwanahabari wako mpendwa Ali Badawi. Kwetu wananiita mteule na wengine mniite mjukuu wa Masai, because I'm Kenyan by blood, American by design, Masai by choice. Sichagui, sikagui na sibagui. Karibuni.
Welcome to the OneMic Show.
Now, before we get started, a quick announcement. The 2026 annual conference of the Kenyan Nurses Association of America is happening in Baltimore, Maryland from September 17th through the 19th. The 3-day event is being hosted at the Sheraton Baltimore North Hotel located at 903 Dulaney Valley Road in Towson, Maryland. Details on how you can register are on the screen. You can also find a link in the comments and description of our Facebook pages and videos. There are also limited vendor sponsorships opportunities available. For inquiries, please call 848-224-1201. The number again is 848-224-1201, or email info@kenyannursesUSA.org. That is info@kenyannursesUSA.org. So whether you're a nurse, a healthcare professional, a sponsor, a vendor, a student, or a community stakeholder, this is one landmark event that you don't want to miss this September. And now, let's get back into tonight's conversation. Now, every year, thousands of Kenyans in the diaspora travel home looking forward to one thing: real Kenyan food, fresh vegetables, meat from the local butcher, milk, eggs, fruits, and meals we confidently call natural and organic. But then the family WhatsApp message arrives. Someone has diabetes, someone has cancer, someone who looked healthy is suddenly battling a chronic illness once associated mainly with Western countries. So tonight, we want to ask a disturbing question. What if the Kenyan food we trust is no longer the food we grew up eating? And as chronic illnesses rise, is Kenya also becoming Big Pharma's next major frontier? Our guest tonight is Christine Ouma. She understands this world from the inside. Now, Christine is a registered nurse, a certified infusion specialist, and a CEO of Healing Bridges Infusion Specialists in Houston, Texas. Now, since 2007, she has worked in the highly specialized world of infusion medicine, where one nurse can administer approximately $140,000 worth of medication in a single week. We're going to be talking about that. She has seen how chronic illness, specialty pharmacies, and pharmaceutical companies connect, and tonight she will help examine what those lessons could mean for Kenya, from our changing food supply to foreign health agendas, to whether Africa is being helped, studied, or exploited by foreign agendas. So without much further ado, ladies and gentlemen, type Karibu in the comment section below and help me in welcoming the bold, the visionary, the dynamic, RN, CRNI, IgCN, Christine Ouma. Christine, karibu sana to the OneMic Show. Can you hear us?
Yes, asante sana for that glowing introduction. I appreciate you guys for the platform to have this conversation today.
Okay, amazing. Now, all the way from Houston, tell us, Chrissy, before we get started, before we get to what these interesting acronyms mean, when you remember the food we grew up eating in Kenya and compared to what children are eating today, what is the biggest change that you've noticed at the most very basic level, Christine?
My grandmother's granary, where they could store corn, we don't have those anymore.
Okay.
That's the one thing that stands out more than anything. I remember all the different types of corn we used to eat, mahindi, maize.
Mm-hmm.
We don't have those anymore.
So what do we currently have? What are people currently eating?
Corn is one of the most common GMO food. Corn and soy food, maize and soybeans. Those are some of the most common GMOs anywhere in the world. In Africa, here in the US, most of the places that grow corn and soy most probably do use GMOs, because that was one of the first ones that they started spreading out was soybeans and corn for their GMO agenda. So kama unakula ugali, chances are is some chemicals accompanying your nyama choma. Okay,
so where I'm a bit confused, like if you bought your mahindi in a market, uko ushago, you know, like what is the difference between that mahindi and the mahindi that you used to eat, you know, like when your grandmother used to, you know, like get it from the farm?
So this mahindi have been genetically modified also to be very specifically to be able to use certain types of fertilizer. At some point a while ago, people claimed that we had food shortages and decided they needed to fill in the gap for the food shortages and starvation. And one way to do it was to make all this corn that is weed resistant, drought resistant, and all of the other things, pest resistant. But to make this corn be resistant to everything else, they can only use their seed, their fertilizer, and everything that's almost curated to this corn. So this corn, you can't just drop it anywhere and it grows. It needs its own fertilizer. It needs its own systems. But in the process of the modification and the use of fertilizer to make this corn actually grow from ground all the way to harvest, it's accumulating a lot of chemicals, a lot of changes. So we are no longer eating maize, just simple maize like we knew it. Now we are eating maize, but it's connected with other things. It's not just simple mahindi.
Okay, asante sana, Christine, and we're going to be talking about what the impact of that is, you know, because we, for the most part, people were thinking this is only happening here in America, but you're telling us that even a lot of people who are just enjoying ugali and basic foods in Kenya, that this is exactly what they're experiencing. I want to come back to the studio first before we continue, Christine, to my very able panel here. I'm going to get started with DJ Omosh Fire. DJ Omosh Fire, karibu sana. DJ Omosh, you've already heard that the ugali you've been eating, you know, like you've been enjoying when you go back home, is not organic. The corn, the mahindi that you've been eating is not necessarily, it's full of chemicals. So maybe DJ Omosh Fire, tell me, has this something that occurred to you? We've always known that we eat dirty food here in the US. Did it occur to you that Kenya is also in that same direction? DJ Omosh Fire, karibu sana.
Asante sana, Ali. And thank you to our guest all the way from H-Town. You know, Ali, it's interesting about, I think, to answer your question, I'd say that for Kenya, yes, I know that there's some aspect or stuff that is no longer what we knew it to be, or the organic, or should I say what we call the authentic chakula ya shamba. Mm-hmm. You know, it's not all of that, because there's also a lot of imports as well, right? Yeah. So, like, you know, you go to the supermarket, you're going to find a lot of imported stuff. Mm-hmm. So basically, remember growing up, every day we went to the shop. Yeah. Other than buying milk and bread, we were going to buy vegetables. Yes. Then Mzee would come in with nyaks, if he had pitted by the butcher, or there was maybe some nyake that had been, you know, thawed out from the freezer, kutoka zile mabag. I don't even know. 19 before Ziplocs. I don't know what those bags were called. Lakini walikuwa na majuala zingine walikuwa natumia. Yes. But so now, fast forward to even you look at the population now. When we came here, our waistlines were all small. I don't know whose waistline was big. At least sisi watu naweza sema wako hapa kwa Iru.
Mine is still smallish. Yeah.
Ali, do not have
okay,
me
okay,
remove...
let's tuendele.
Okay. When you are a boy kule in Nyayo Stadium.
Okay.
So fast forward for all of us, after 6 to 8 months of being here, your waistline has grown between 6 to 8 inches.
Yes.
Upende usipende. And it's based upon the food that we're eating here. So as we're like, okay, over here kuna makemikali, lakini home vitu ziko sawa. Now when we go home, you notice that chaps are not going to the store every day.
Yes.
They stuff in the freezer. Things are packaged. Sijima frozen. Hata unaweza pata mrenda frozen. You know, there are certain things, or dried, if that's what they want to call it. There's certain things that you look at it and you're like, hey, okay, hapa kuna vile. And if you look at the population girth of those around, watu ni wanono.
Yes, people.
Compared to our time, I think our time, the average waist ilikuwa 30.
Yeah.
If kwanza ukifika 30 kwanza we ni mnono.
Yeah.
Ulikuanga hapa unacheza 28, 26. You are not figuring that. Mtu wa 30 na mpaka 34. Sasa we ni mnono.
Yeah.
But over here we've all obliterated those waistlines. We don't even know what those waistlines look like anymore.
Kabisa,
so but
true.
now you go home, you see it's the same thing. And back to Christine's point about that granary of grandma, the basket that was with cow dung, and then they used to go inside. And in fact, I used to even wonder how they used to fika uko juu, because there's like a hole uko juu. And they somehow they get the mahindi, they come, they grind it either kwa mawe ama inapelekwa kwa posho mill, and you saw, the food was made fresh. You know, I guess I'd say from farm to table.
Yes,
it's no longer there.
Okay.
And we've had all these stories about GMOs, and I don't know if it's say the government being compromised by the big companies out there bringing in things, and there's so much. So Kenya, not surprised. Hapo kwa granary or grain, to me, as I know it, as I've been told, if I stick to the brown stuff, then the likelihood of me going south by southwest is a little bit less. So I stick to the brown. Easy as a white, Maza, you have to pay me.
Okay, sawa. We're going to be discussing all this and what impact this is having on our health. The number to call is 202-683-4570. Press *5 to speak. Christine Ouma is with us live. We are talking about what is happening to the food system in Kenya and why there's an increase in chronic illnesses and lifestyle diseases. Now, before we go to Mika, a couple of comments here. I can see Hanigal Njeri pale kwa YouTube. Hanigal, karibu sana. Hanigal says, I remember Christine once telling me about her going to her grandma and the corn in her granary deteriorating into dust instead of staying hard and preserved for months like it did back in the day. We're gonna ask about that because these are those conversations that people normally don't have. Sometimes when people don't know that whether this is a conversation that needs to be had. Washeke here on Facebook is saying Monsanto is on a quest to control food production from the seeds to all factors of production, supported by that foundation. I won't mention because Sina lawyer, then they are behind the Kenyan bill
already said
to ban indigenous seed sharing and vaccination of our cattle, but she spelled lawyer L-O-Y-A, so it could mean anything. So let's go to Ika before we come back to Mubelwa to say one or two things, and then ama tutenda kwa Christine, tuarudi kwa Christine. So Mika Och, twende kazi. What do you think about this, the changing food patterns in Kenya? Mika Och.
Thank you, Ali, and thank you everybody for joining in today. Thank you to our guests for joining us today. It's simple. Kenya is a developing country. Kenya has developed. It's not like it used to be. It has a spike in the population. We've had issues of food security, and as it's been part of the normal world, it's usually you depend on if you cannot sustain yourself, you don't have enough ways of making money to run yourselves. You depend on other nations for donations, and they will give you terms and conditions of ways to be. And remember, as somebody has said down there in the comments, there is a race in making seedless food so that food is provided by single entity instead of people being able to provide food for themselves. I don't think there's any more way you can control people than if you're the one who decides how much and what they can eat. You control them more than even you deciding on, than giving them money. Because if you can control to malnourish or undernourish a certain region to compare to another region, you can easily control the population numbers of that region. Anyway, before we go into all that or any conspiracy, factor that is contributing to this influx of foreign food in Kenya is our own tastes. We do not like our own things. We like foreign things. We like new shiny things. We like things that we are not born with. That's right now we import our sugar, despite having a very rich sugar providing region. You will go to the supermarket and you'll find that the Kenyan coffees are not the majority brand. We have other coffees that we've sold, coffee that has been imported. Same with tea. Things like tomato sauce, ketchup, even candy has changed, and the ingredients are totally different, even just the ingredient in soda. So the packaged stuff that we have back home has, most of it is not locally manufactured, is imported, and we don't have the regulations that are strict like European countries. So we know that's going to be a dump that's going to be put there. So there's so many contributing factors that come in, but at the end of the day, if we have things like fish, tilapia, that is eaten in Nairobi is nowadays farmed tilapia, not tilapia caught from the ocean, and this farmed tilapia is tilapia from China, it shows to you how bad our food distribution has fallen.
Wow.
Back to you in the studio.
Okay. Wow. Yeah. I mean, this is super crazy because a lot of people don't know that some of the tilapia that they're eating in Nairobi is actually made in China. Back to you, Christine. When Kenyans say our food is still organic, what exactly do they misunderstand, Christine?
So it depends on where you're shopping from, really, honestly, because there's certified organic and then there's the people at the shamba who haven't been certified yet. So the certified organic is like less than 5% of all our food. And then there's the small shambas out there who nobody's really looking at and quantifying how their food is organic, or these big corporations haven't reached them yet. So they're still using the old ways, but those are small and their products don't usually reach the market. Matter of fact, a lot of our organically grown food is usually for imports, not even for us.
For export.
For exports, I'm
Yeah.
sorry.
Yeah.
Yeah. So a lot of the organically grown food produced in Kenya will go outside first before it reaches us. So I think on this one, it honestly depends right now where we are, because it's not as prevalent as here, but you can see the growth going up very fast to where our food is not the same anymore. So depending on where you're sourcing your food from, you might be able to get organic. Kama uko Ocha, saa zingine deep where they haven't been touched by large scale farming mostly, you should be okay. If we are eating foods that are coming from large scale farming, chances are they're using these practices that are not organic.
So are you saying if I go to Marikiti, and buy it from a mama mboga, and that's as organic as it gets in my mind, are you saying that food is likely not organic?
Yes.
Wow. Okay. Now, I mean, this is so shocking. This is so shocking because whenever we go back to Kenya is when we brag. We even take pictures of our food. We're sending to people over here, look, I'm eating organic and you're eating food
even
from
in the shamba when we are catering or pulling the
yeah.
nini, yeah.
But so if you're in Kenya today and you're just, like an ordinary family, where do you source organic food? If you're living in Nairobi or maybe you're in another big city like Mombasa or wherever you are, like where and how do you know this is organic food?
The farmers are so few that even market themselves out there. Me, I know very few farmers who I see very active on social media who've been doing it for a while, who caught on that there was a problem coming up and they fought to keep their organic shambas, which they're usually very, very small farmers compared to the demand. So then they can only sell to, now we can source it, just like we do here. We'd have to Google organic farm near me. Then you make the drive to them. That's where we're going to be in Kenya very soon, but that's where we are very directed when it comes to closer to the city, especially the people who are doing farming in large scale, who are not deep inside shags. Yeah. It's going to be mostly organic.
Wow. This is shocking. Honey Girl and Jerry here says, can food be organic if the seed is not organic? E.g., my seed is not, but I grow it at home with manure from my local cows and goats. Christine.
A lot of the time, those seeds that are not organic require their own things. They require their own fertilizer, their own pesticides. So the company that usually control the seed will also control the pesticides and things that it requires to grow, and herbicides or whatever else. Otherwise, it's going to be eaten by the weeds. So what they do is they create weed killers or pesticides killers that kills everything except that GMO food.
My
so
goodness.
You'll find around the maize that's GMO, if they're using like a herbicide or a pesticide, it's going to kill the weeds, it's going to kill everything, but that one mahindi is going to stand green and tall. It will not be affected by the fertilizer. So if you're getting, chances are if you're getting seed that's already compromised, you need their stuff for it to grow the way it's supposed to.
Wow, shocking. Number to call 202-683-4570. Press *5 to speak. We have here Christine Ouma from Healing Bridges Infusion Specialists. She's an RN, and she's here talking about like our food supply in Kenya and why the food that we think is organic may not be organic. And we're going to be talking about shortly about its relationship to like the lifestyle diseases that people in Kenya are getting. And Honey Girl Jerry here on YouTube is saying, I know farmers in Kenya who will not eat food they grow for sale. That is very dangerous. It's very dangerous to know that there are people who are growing food.
Can she tell us who they are so that even us, we don't buy from them?
Yes. So Honey Girl Jerry, type up and let us know.
Very prevalent with this issue. Potatoes is very prevalent with this issue right now, where the farmers will not eat their own produce, but they need to grow the potatoes and make money.
Yeah. Okay. That is mind-blowing, almost.
Yani, she said potatoes, then I thought of, for us guys, Ali, you may or may, I don't think you don't have this issue. Well, you might. We buy potatoes on our way from shags or to shags. As we go along.
Zile kwa kwando.
Yes.
Yeah.
Alafu najua kuna kamawe chini.
There are rocks down.
Yes. Alafu. So, ananiambia, hata hiyo mawe, pia sasa ni mbaya.
So I think...
Yani, this thing it's so mind-boggling, because think of it this way. I think for all of us at Shags, we all have our kitchen gardens. In Shags, like within the kaboma, there's at least a small little patch that at least caretaker, akona ka mboga yake, akona sijui nini, all those things. And then before you leave to go back to the city, you go, they tuna for you, unaeka kwa zile Ghana we go, and you go as you're going.
Yeah.
Boss, tumeko tukikula vitu zingine about, because now you're like, yes, I got the real organic deal because I went Shags and I got it and I'm seeing it being pulled from the ground.
Yeah.
But the seed was already compromised from day one.
Okay, wow, this is very shocking.
How many, when you go to Shags, look at how many agrochem businesses you have in a small, say me, I'm from the small town of Ndiwa. In Ndiwa, there's going to be like about maybe 10, 15 agrochem businesses
but
in that small city.
But agrovet waga kwa sababu si waga na termites.
So now you're saying there's businesses that are coming up around that
she's
idea.
Right. The agrovets,
I think
they're almost more than pharmacies. in within a certain area. If you just look at
but it has to be. The thing is this. Yes, I get what she's saying, because as I said, I remember that the reason these Mahindis came out, Kina Katumani and their friends, is because of things like droughts that we've suffered over the past, right?
Yes.
We've had food shortages over the years. So there's always been that research of trying to get drought resistant. And that's where GMO comes in now. They create, they add something into the seed which makes the seed survive, whichever that area was killing the indigenous maize in that area. So they give it an edge to survive that. Alafu, remember, these people also have animals which they depend on, and they're usually small animals. So but somebody has a few goats, cuckoos, ngombes, and that ngombes, the ngombes, they'll depend maybe for 2 or 3 ngombes for their milk, and the milk that they send to the depot, and they depend on their chickens. They sell, they eat, they provide eggs. Like literally, agriculture is still part of their day-to-day life, despite us living in the city with the kawaida maisha nini, au lazima waende kwa shamba. Shamba ni kitu lazima kuwe nao.
Correct.
And then remember, Pia, that particular time there was a whereby we were doing a lot of large-scale, what do you call it? Cotton and sugarcane farming. And then the sides of the flat sides, they were doing a lot of rice farming. So agriculture was the bread and butter of the area, and it's still the bread and butter for the area right now, because as much as those industries have gone away, people are still thinking of other ways on how to survive and growing. And that's why she's right in saying that you might think you're eating something unasikia imetoka ushago, but sasa sisi kama tumeambua sahi mkipanda cabbage, hizo cabbage zinaenda na mnaletewa seed na hiyo ndio iko kwa duka na kile. That's what you're going to buy. So those agrovet business are going to be there because the business there is farming. So it's an all ecosystem supporting each other.
I think I'm getting what Mika is saying.
Yes.
The problem I have is when organic seems to be primitive, even those who have access to it, they don't want to eat it, anataka kwenda KFC.
Yeah.
Okay. So there's this thing of, okay, they're using this because there was a drought, there was a food shortage and all this stuff. I get it. To me, it's when it's done either willingly or people are being misled and believe that, this is what tastes good. So to the point that right now you go, it's the same in TZ, right? You go there and then you find out people like, that one, no. Ana viazi, hataki kuvitengeneza, anataka kwenda kuchukua via salon. Sasa hivi kuna maandazi yako packed. Okay, vitumbua,
packed.
Packed and everything. Na mtu anaona mama anapika pale and they'll be like, no.
Nataka kwenda kuchukua dukani.
Nataka nenda nikachukua cha Azam.
Oh, cha Azam. And that's very true, Bandio, and that's the problem in Kenya right now.
Yes.
My first statement was the problem in Kenya is that we have a habit of hating our things and assuming that something that's foreign is superior to what we have.
Yeah.
Like literally right now, supermarkets in Kenya are stocked with foreign stuff.
Yeah.
To a point where when you go,
Azam.
Yeah, but hata siku hizi nini tuzo pia wanauza nazi tu ya nazi kwa supermarket. Like unaangalia vitu zeje uliko like mimi nashanga yani mmenyang'anya mama wa kuuza githeri kazi.
Unajua, one interesting thing I noted when I went to Tanzania, not the last time, this was a couple of years ago, because mimi nikenda Tanzania and Dar es Salaam, and I also have family in Zanzibar. So in Zanzibar, there's a part called Forodhani, where they have all these nice foods that they cook every evening. So I went and noticed there was something slightly different about the chickens, because mi najua chicken ya huku. Now, what I came to learn is that Purdue chicken, made its way to Zanzibar. And now, like in Forodhani, some of the chicken that you're buying there, like some of that very nice chicken that they make there,
very nice,
is actually, it's now no longer tasty. Not so nice.
It's
and
tasty looking, right?
You Purdue, the sellers like it because it's bigger.
It's big, yes.
No, najua uko nyumbani watu
Na
wanapenda
upiki
kiona
sana,
ni kubwa.
you just a little bit
Yeah.
ni dakika tano.
So the interesting thing, like when I noticed that, cousin yangu akaniambia ninyamaze. I actually have a cousin who used to work for them in Zanzibar. Na akaniambia nisilete nini yangu. Nisilete
mdomo yako.
Nisilete Marekani wangu.
Na mdomo yako kwanza unajulikana wewe.
And now the interesting thing is that Purdue was not allowed in Tanzania bara. They were not allowed there.
Interesting.
Because I think the departments of agriculture, the ministries of agriculture and health are separate.
Yes.
So they were denied access to Tanzania bara. But in Zanzibar, they're there. And in Kenya, they're also there. Kenya, like everyone is allowed to come in left, right, and center.
See, we are open for trade.
But swali, kwa Honey Girl na wengine, wale huwa mnatoka Kenya, all this time mnatuambia, taste ya chakula ni
tofauti.
Yeah, so tuseme kwamba ni mentally kwa sababu mnaondoka kule mnakuwa tunabelieve kwamba it's organic.
Hapana,
I don't know.
I wouldn't say it's mentally. I wouldn't say it's mentally bandio kwa sababu ya
watu wanasema viazi organic vina taste poa.
Kwa sababu wacha nikwambie
viazi ya Nyandarua.
Yeah. They do taste different.
No, it tastes different
wanapika na mafuta transformer.
No, kwa sababu ukiangalia hata si mafuta transformer, ukiangalia pia ni kuna ile most of the seed that is planted there ni seed ya huko yenye imekuwa tu genetically modified from there. Like it's usually not hiyo seed ukipanda huku, that's why ukata kuleta seeds from other places kuzungusha hivi, right? Because first of all it will be invasive, maybe because how it's supposed to survive, will plants produce, they're trained to produce a weed killing a protein that kills other plants around them. Ikikuja huku itaua plants zingine. So actually the local is fine.
Okay, Mika, you're breaking up. Yeah.
Ajalipa bill ni sawa.
Yes. So
how do you mean?
We can't hear you, Mika. You're kuna kaki.
Ni wapi mlinipo?
Okay. Yeah, as we try to get Mika back, wacha turudi kwa Christine. Now, Christine, now just to take a little bit of a tilt. And before I go to you, Christine, Washeke here says, who feeds you, controls you. Excited to have here, Chrissy. Is there a correlation of the adulteration of our food supply to the rise of cancer? In some parts of Kenya, farmers are disproportionately affected by cancer. We're going to be talking about that. And then Sharon Mumbi here is asking how organic is organic today. We're also going to be talking about that. We've already been talking about it. And then Honeygirl was saying sometimes the problem in Kenya is not the seed, but pesticides used. Not sure about fertilizers, but for sure the pesticides can be a problem. Now, to take a slight different tilt, Christine, before we connect this to Kenya, help us understand the world you work in, because I think that's important in bringing this to the food supply in Kenya and what's happening to it. What exactly is specialty infusion treatment, Chrissy?
So specialty infusion comes in for it's like pharmacy for any other, but then the pharmacy that takes care of the infusion side, they're called specialty pharmacy. So then we end up being called specialty nursing or specialty infusion, because the medications that they do will be those high-end, big money pharmaceuticals that have been made specifically for very rare illnesses like multiple sclerosis, like ALS, that's Lou Gehrig's, things like Crohn's or colitis. And those are illnesses that are chronic illnesses that most of the time are caused by lifestyle issues, things that we do not honor in our lifestyle. And we know one of the biggest lifestyle things is diet more than anything else, really. Before we breathe in bad air, before we smoke or drink, usually the food is the first one. That is the biggest one that causes chronic illnesses. And then there's other stressors, like actually stress at work, day-to-day living with high stress all the time. Those also cause chronic illnesses. So then what happens in my industry of infusion nursing, specialty infusion nursing, is we take care of these patients who have these illnesses that do not really have a cure, or they say, this is what they say, do not have a cure. So the reason you need the infusion is because it allows you to live a normal life. For example, if you have Crohn's, if you do not get your infusions for whichever medicine you're supposed to be getting, you miss 2 doses, your stomach will not let you be able to go to work. You need to sit next to a restroom at all times.
Wow.
Sometimes the diarrhea is so much, the weight loss is so severe, the iron loss is so severe, the abdominal bleeding is so severe, you have to go to the hospital. It leads to death sometimes. So that's where we come in. We give these infusions for chronic illnesses. Chronic means long term. Acute means something that caught you quickly. Chronic means you're going to suffer with this for a long time. Those are the cardiovascular issues, the arthritises. Those are long-term illnesses that you cannot just cure. Then they've come up with these medications that we now infuse. That's where I come in, to help you maintain some sort of normalcy, or you'll end up on a wheelchair, you'll end up sitting next to a restroom all your life, for the rest of your life, or ending with a pouch, a poop bag, or dead, or, you know, it's a lot of various places where you can end up if you do not take care of your chronic illnesses.
And what is it that got you into this particular area? You know, like, I know you're a registered nurse, but I never heard about specialty infusion until, you know, like, I saw you talking about it on your Facebook page. You know, so what is it that made you want to specialize in this particular area?
So this was just by luck, actually, because as a nurse, even as a nursing student, I already knew that I was not going to make it being a regular floor nurse. I could already see that was not the calling for me.
Yeah.
So within the first year of being a nurse, I'd been fired like 7 times.
Huh?
7 times?
Yes.
How is that even possible? That's like every 2 months.
Kama sija walk out of the job, I've been walked out by security.
Akupenda nini? Akupenda damu, alafu ye na bedpan,
I deal with
hand
blood
bedpan
every
on bodies.
Yeah.
I'm inside blood every day. But I ended up in infusion nursing and liked it because of the autonomy of it. I don't have to work for a hospital. I don't have to. So for the longest time, this has given me the autonomy to actually enjoy being a nurse compared to being a hospital nurse.
Well, this, you know, this infusion, is it something, I've never heard about it in Kenya. Is it something that exists in Kenya?
Not yet.
Not yet.
Now, yes.
Yeah.
Right now we do have, so the specialty doesn't exist yet.
Okay.
We do have some of these complicated medications that we give here in Kenya, but most of the time they're given in a hospital setting. Now that we have a prevalence of chemo, I see some centers opening, which are not really hospitals, but people can go. But truly, no, it's gonna be new. Infusions are done in the hospitals. Okay,
so with the trajectory that Kenya is taking, you know, like, and the food that we are eating, you know, like, heading in this direction that where the US currently is this something that maybe you're seeing is gonna have a demand in future at some point?
Absolutely. We are importing the same diseases, and our problem is we are importing it from here. See, I don't mind us sharing information with people who are ethical the way they do business. You'll notice that a lot of the things that are allowed here are banned in most of European countries.
Wow.
Or Asian countries.
Yes.
Meaning they're a little more ethical in safeguarding or taking care of their citizens. Here is free market. Kenya is free market.
Willing buyer, willing seller.
Willing buyer, willing seller, whoever is willing to be bribed can be bribed to let these things in, slide in more easily. That's why it's problematic for us. So we are importing their foods, we are importing their problem. Okay,
so now with your company, is it a clinic that I can walk in, I tell you I have a certain syndrome, give me 140K worth of medicine, or who pays your company? How do you source your patients?
Big Pharma pays me.
Okay.
Huyu alikuwa compromise. Ako na envelope kubwa.
Okay.
Big Pharma pays me. I don't even get my clients from the doctors. I get my clients from the specialty pharmacies.
When you're talking about specialty pharmacies, what are those? We know CVS. We know
So what
Walgreens.
is CVS?
Yeah.
Behind CVS, work on another section. Almost
Yeah,
all the
they do.
pharmacies that you know,
Yeah.
they have other sections that specialize in some of these very high-end lucrative medications.
Okay.
That are also risky to infuse. They are typically, life-threatening. So it's not just a pill that you can puke out. So they are very highly specialized and need highly skilled nurses and highly skilled pharmacists who are not the same ones who count pills at the pharmacy counter.
Okay.
So they have a different set of skills to do the type of in disbursing of these medications.
Okay. All right. Good. And what kind of illnesses require, like typical illnesses that some people know require specialty infusion? Or is it these illnesses with complicated names that we don't even know what they are?
So we do have some of them like chronic, demyelated. So a lot of them let me put it like this. A lot of them will have issues that are like neurological or systemic that cannot just be healed by like a pill. When they come, they take everything. So it will come and say, take away your leg. So you need to rebuild
Oh la la.
way to walk.
Yeah.
Or it will come and take away, say, your bowels, and a piece of your bowels need to be cut off, or so that the inflammation can stop. So we have Crohn's, we have colitis, we have things like multiple sclerosis, Lou Gehrig's. Those are just some examples.
Okay.
Is Parkinson's in there, or that not so much?
So not really. They're working on a new infusion medication for Parkinson's. If it's out yet, I'm not privy to it yet. It hasn't reached me yet, or I haven't looked into it that much. But they were working on something for Parkinson's and Alzheimer's.
Okay.
All right. Yeah. So this is quite interesting. And what does a typical infusion visit look like? Is it like a walk-in, walk-out, like how we walk in and walk out of CVS, or what does an infusion visit look like?
So typically we see the patients either in their homes or in an infusion suite. So you can have a doctor's office can have an infusion suite. Say a gastroenterologist, who is the one who deals with a lot of Crohn's patients or colitis patients, or rheumatologist, who is the one who deals with arthritis. They can have an infusion suite in their office. A lot of them, because they are specialists, they are not that many. So they end up with so many patients. People drive from far to come see these little specialists, okay? So then they'll end up with infusion suites. The big pharmacies will also have their own infusion suites, or will come do it in the patient's home.
Okay.
The big hospitals too do have their side that is for specialty infusions.
Okay.
Wow.
And then you also mentioned that that one nurse doing a 40-hour work week can administer approximately $140,000 worth of medication.
That can be a day. So even
That's a day.
Yeah.
Wow. $140,000 worth of medication.
That's nothing. Some of the medicines cost $250,000.
Wow. And is this covered by insurance, or who pays for this?
Big Pharma.
That's where the politics come in.
Oh my goodness.
Big Pharma.
Yeah, that's where the jokes.
Big Pharma. Then on the back end they get paid.
Somebody is getting paid somewhere. The patient is not.
Okay.
But somehow they figured out how to transfer funds and payments through insurance and through pharmacy, through discount programs and all of those other
Localities.
Yeah.
Yes.
But what is it that's making these drugs so expensive? Is it their cost of production, or what is it making them so expensive?
So what mostly happens is, say, a rare disease like MS, which does not affect many people. Somebody will do some research and development. Say my mom has MS, and I'm a researcher. I go research and keen on it and do everything I can, look for funds, then somebody will, as you're looking for funds and talking to other peers, somebody will know that you're getting close to a treatment for MS or something good for MS. Then the big investors will come in. And then they will start, because the medicines, the people who need it are so desperate, and they're going to need it every month, they come in and price it so high to where these people cannot do without it, but still they have to pay all these thousands of dollars to get it. So when the treatment comes, before it becomes, usually they have a patent. Okay?
Yeah.
So nobody else can copy that medication for a number of years.
Yeah.
So while nobody else can copy that medication for the number of years, this pharmacy is the one who decides how, or rather the manufacturer of the medicine is the one who decides how much they charge for it. And most of the time, the R&D, that's already been paid off by the time the medicine is there in the market for a year or two. After that, they're just making it's just pure profit making.
It's pure profit.
Out of desperation, because people are desperate and will pay for the medicine.
Supply and demand, Ali.
Yes.
Okay. And what happens when maybe a patient loses coverage or can no longer afford treatment?
They dump you. There's another patient they'll go for. If you do not have coverage, a lot of the patients cannot afford to pay for even a single dose if they do not have insurance coverage.
Wow, this is...
Or it's covered by the state or some program.
No, what state?
There's no so for these types of diseases, are you saying that things like, say, hypothetically Medicaid or Medicare don't cover, those types of programs, or there's up to a certain point?
They will cover, but because of the cost of the medications, they will also find very many reasons to deny them. And also, they'll also request that you change from what the doctor has been giving you and try other things. So they might return you to trying things that already failed for you and take you off of the one that works, because they're not going to pay all of that money.
Okay, so basically, is it the difference between what generic and I don't know what? Basically, they're trying to push you to the cheapest path.
So sometimes yes, the insurance, depending on who your insurance is,
correct,
they try to push you to a cheaper, maybe different medication, or you're just dropped. I'm sorry. You don't have insurance anymore.
Okay. And then the other controversial question, because these drugs are very expensive, so this specialty of infusion within the nursing field, it must be very lucrative. Like it looks like you guys are making quite a bit of money.
It is.
Yeah.
But not really. It is depending on who pays you, because the way insurance is set up and the way it works, Medicare and Medicaid and them do not like to pay for it.
Oh.
It's expensive. Yes. And even the other insurance, they do not like to pay for it, because say I need an RN to do these infusions. And for the RN, so most of the medications we do can only be done by a registered nurse. It's already expensive to hire a registered nurse as it is. Some of this infusion, the insurance will pay you maybe $10, $20 over what you're supposed to be paying.
Wow.
The RN.
Okay.
So personally, I don't take insurance payments at all.
I
get paid by Big Pharma.
Yani,
okay, so
Christine,
you go direct to the source.
Yes.
Okay.
Ali, she has told us basically we're not her patients.
Okay.
No, you are my patients. You're just not the one who's going to pay me. I'm going to pay you.
Now, how does this work outside the United States? Like in places that don't have this predatory, like profit-making situation, like Canada, for example.
Yeah, next door.
Canada or maybe even Europe. How does this work?
Let me give you an example of something specific. I'll give you India.
Okay.
So Crohn's and colitis is very common among Indians. And also a lot of my patients here are Indian. So the way India does it, we give the same medications. The way India does it is they give you the medicine as a patch. They give you like a year. And then they also help you with lifestyle changes. So you're not or forever dependent on this medication.
Huh.
So after a year, it's given you what you needed to be able to be weaned off. And then now you can do the maintenance with your lifestyle changes. Meaning, now every time you have a flare-up is when you'll need these infusions rather than for the rest of your life.
Rather than chronic, basically.
So what
If
you're
it's a
saying?
chronic illness, you didn't cure the illness. You just now know how to
Manage it. Okay.
Yes, by yourself without depending on Big Pharma to provide.
Is that something that you see they're leaning towards here for the type of I guess medication practice that you're doing, or they're still going with okay, we found somebody to pay for it, we'll just keep going with it? Are they trying to teach the patient how to become?
Nobody's teaching the patient anything here. It's all capitalistic. Patient is fragmented into sections. So your stomach is hurting, go see your GI doctor.
Yes.
Your head is hurting, go see your neurologist. Your heart is hurting, go see a cardiologist. So the patient is broken into every single body.
Yes.
Okay. Most of the patients here that I see, the most common question I get from patients is, when can I get off this thing?
Wow.
But sorry, Ali, if pharma is not pushing for that, then it seems like it's never going to happen.
It should be the doctor's job.
Okay.
To help educate the patient what they're getting on. It should also be the nurse's job to help educate the patient what they're on. It should also be the responsibility of the patient to want to get off this medication. Okay, so the three of us.
Yeah. So this sounds so complicated. Might it be wise, especially for people who have these kinds of conditions, to maybe try to go seek assistance in another country? Because if you're saying they will put you to a regimen where they'll teach you how to get wind out of it and change your lifestyle, might it be wise to go somewhere else, like do it maybe for like a year or a year and a half, and then learn how to wean yourself out of it, than stay here and stay in it for life?
Now, if you can afford to move to another country for treatment, yes, absolutely.
Yeah, that's a medical cover.
What we need here is one thing that is lacking out of almost every medical practitioner's office. When was the last time your doctor's office said, okay, let me grab my dietitian or my nutritionist and let's discuss your diet? Anybody in the room?
No,
it's happened to me a couple of times.
Yeah.
You're lucky.
Yeah, it's happened to me a couple of times. But I think it's also because of the cover that I have.
Yeah.
So one thing I noticed that there's a difference between when you have, I guess, a regular, what I'll call HMO, versus the other ones that are yes, where or should I say a one-stop shop, like to say, I'm just gonna throw a name out there like Kaiser.
Like Kaiser, yeah.
Where everything is all in one.
Yeah.
So a lot of what they do is they tend to try to keep you, I guess I'd say, to maintain you or to teach you how not to go down the wrong path.
Okay. How to manage.
Yes.
Yeah.
So that their costs go down.
Okay.
Because the more people come to them, then the more
the costs.
The costs are gonna go up for everyone. So they're trying to get everybody away. So like let's say hypothetically, vitu kama ma GLP.
Yeah.
They are very rarely allowing you to even go the GLP route. Yani the doctor will tell you straight up, boss, hapa ni kuna vile unafaa kwenda kupiga rodi na uchange diet.
Okay. So they're incentivized to want you to stay healthy so that you don't have to come back for treatment.
Yes.
Okay.
Yes, because everybody gets affected.
And is that just Kaiser, or is there other insurance companies that have this?
I don't know.
model?
I noticed that with them. I can't speak for other companies because I've had them for quite a while.
Yeah.
So I can't speak for other companies. And maybe also it's
So
my doctors.
The most expensive insurance company, let's say the one your company is paying more money for, you literally see it comes with a lot of bells and whistles, right? This is access to dietitians, and you'll find that you have a lot of incentives to do preventative
medicine,
maintenance of yourself instead of them treating you. Most of these cheaper ones don't have that option of giving you access to preventative practices. Now the thing is, when you do a lot of these preventative things, when you take advantage of them, you stay out of hospital. When you stay out of hospital, they don't spend money on you. So that money goes somewhere else. So the only thing is they encourage you, the only time they want you to in hospitals when they're going to do for your annual checkup. And during that annual checkup, you'll find they'll even give you, like you find the more expensive insurance you're told the insurance pays for your gym. They're like, you will pay for your gym, will pay for your nutritionist, will pay. Like for me, I didn't know I had that sparks until I got interested into that. And I realized, all these things that I used to thought to be thousands and thousands of dollars, I'm actually doing them I'm getting them covered for free. So it's a give or take. But then now these are the insurances whereby if you got a chronic issue, they'll pay for you. You're not going. Have you ever been sick? You think you have insurance, and then you're told, we will cover 500.
Yes,
That's
not
13,000 is yours.
1,000 deductible.
Yeah.
Yes.
Angalia, have you watched John?
That is deductible. Wanakuambia we will cover 500.
Yeah.
13,000 ni yako.
Oh my goodness.
And there are some things they don't cover. Tuseme kama kuna vitu zingine, tuseme, I'll just throw something out there like IVF.
Yeah.
They'll cover consultation. They
IVF,
don't cover.
You mean in vitro fertilization?
They'll cover for consultation, initial, unaenda consultation. Everything else after that, toa kwa mfuko yako.
Unajilipia.
Yes.
Yep.
Okay.
So then there are some insurances that will cover the whole process. Mpaka kufreeze.
Yeah, I think we need to have another episode specifically on insurance. But back to you, Christine. After almost 2 decades in this system, because you've been in this for a while, what have you seen in America that makes you believe Kenya may be heading towards the same kind of expensive treatment economy? Christine.
So somebody had mentioned earlier about farmers. If the food is killing farmers to grow it, because there's a lot of, if you look at farm towns or farm villages where a lot of food is being grown in large quantities, like large scale, a lot of the farmers in those places have cancer, right? And if you look here in the US, I can give you an example of Indiana farmlands, where they have rural Indiana, where little cities where it was farm towns are literally wiped out of humans because of cancer, because of mental retardation. Children are born with like different types of what do we call them? Disabilities.
Missing limbs.
Yes. So you'll see a lot of those are around farm towns, and that's the first indicator that usually tells us that there's something off. Now, these same practices, I've seen them in Kenya. You hear there's some farmers who are saying they will not touch their own foods. It's not even reported as much as it should be right now, but because things usually take time to come out. But I've seen so many documentaries in Kenya where they focus on the little farm towns where there's a lot of everybody's sick already.
Jeez. Now
GMO was legalized in Kenya in 2022.
Yes.
Before then, it was already there. Let's not, just because it wasn't legal on paper. Monsanto has been in Kenya since 2016. Their office was right there on Mombasa Road. I used to drive by it every day on my way to Embakasi. Monsanto has been in Kenya since, I think, 2016. The government told people that Monsanto had left. Monsanto only rebranded. Monsanto did not go anywhere. So that means the dishonesty, the ease with which we know it's easy to corrupt people in our country, in Africa, because of poverty, because of greed, because of, lack of checks and balances, or whatever need people have for money at that time, makes us a high risk for importing this same type of diseases. But the problem is the way we are set up, we cannot afford the same type of treatments. Hatuwezi afford hata tujaribu aje.
Wow. So we are setting ourselves up for failure. So I see here, this is Andujarapine saying, I feel sorry for Africans of Kenya. The devil is coming and you are welcoming him.
So, in fact, I wanted to ask that guy who cooked ugali on the balcony for this other guy, if the ugali was GMOs, did this guy eat brown ugali?
No, wait. You're talking about Ombachi.
Ombachi, yeah.
Bill Gates. Bill Gates alipatia ugali ya GMO ama alipatia ugali ya brown?
Are you saying Bill Gates, he cooked for Bill Gates?
So wait, so Bill Gates went to that balcony?
I think so.
Oh, okay. I missed that one. I missed that one.
I stopped at Yemi Alade.
Yeah.
Sidhani Bill Gates ameenda kwa hiyo balcony.
Bill Gates alikuwa kwa hiyo balcony. I think ndio niliblock huyo jamaa nikiona Bill Gates kwa balcony akikula ugali.
Yeah, Agal, send us that link. Send us the link.
No, but Christine, you know what you need to understand is that most people have no idea. You know, most people just have no idea. And there's an incentive to keep people in the dark. Mika?
Yes.
No, what I wanted to say is this. What most people don't understand and most people don't realize is a lot of government policy that happens in Kenya. Normal mwananchi doesn't understand. They don't know. Normal mwananchi knows that sisi tunaprovidiwa na mbegu, tunaenda tunapanda, tunakula na maisha inaendelea.
Yep.
That's it. Like there has to be provision of seeds inauzwa kwa sababu umepatiwa, ukitaka kumake pesa kwa hii mbegu yako, chukua mbegu, ukishapanda mbegu, uza mbegu kwa KGGCU. Alafu, like wamepewa corporations za kuuza Kenya, all the produces and how to sell them. So that is their bread and butter. That's how they're going to do. They're not going to ask questions. So that is why you feel when this government came in, wakaambiwa sijua there was a fertilizer scandal, there was a this scandal, there was a this scandal, because there was a seed scandal. They were expecting seeds, wakaambiwa hapana, hii seed ikuje, ngojeni sijui seed gani ikuje. So these are deals the government has made kind of the back door without people knowing. And that's the issue. The issue is that the normal mwananchi just wants to continue surviving while the government is making deals at the back of them or at the back of the mwananchi. So we are being sold out by those who are supposed to be protecting us. As Chrissy has said, unfortunately, that free market doesn't benefit the farmers or doesn't benefit the mwananchi who eats that food. It benefits the few who are paid by those corrupt companies to come and dump that poison in Kenya.
Yeah, and I think here is where I would start telling Kenyans to start paying attention more to politics. And when I say pay attention to politics, pay attention to those things that are not in the news. You know, because Kenyans love entertainment. You know, they love kusikia tirigiji sijui ameenda wapi akamtukana nani. They love such stuff. But then, you know, like when those things are happening, all these bills, you know, like GMO being made legal, you know, like all these agricultural bills, you know, like that are being passed, you know, like left, right, and center. And even ask yourself, you know, like who is writing these bills and what is it exactly that we can do to be able to put people accountable, because these bills, they usually pass, they're silent because the mainstream media, they like noisy stuff. So those bills, you know, they're usually not noisy, they're very quiet, zinapita, you know, like, and then before people know, it is too late. And then Hanigal Jarid saying, was it Bill Gates or the French I remember the French president on the balcony. You are Bill Gates tutatafuta.
Verify. I think nilimwona kwa balcony mahali.
Okay. Aya, sawa. I want to remind the listeners you're tuned into the OneMic Show. The number to call is 202-683-4570. Press star 5 to speak. Things are getting hot in here with Christine Ouma telling us things that you know, like you think you know, but you really don't know about the food supply system. And the fact that Kenya is now heading in the direction that America is in. So hiyo mambo ya taking pictures of food, you're in Kenya, that you're eating organic, that may not be the case. Now, before we continue, I want to remind the listeners also that the 2026 annual conference of the Kenya Nurses Association of America is happening in Baltimore, Maryland from September the 17th through the 19th. The 3-day event is being hosted at Sheraton Baltimore North Hotel, located at 903 Dulaney Valley Road in Towson, Maryland. Details on how to register, we're going to share those with you in the comments, and we're also going to place a link. Then there are also a limited vendor and sponsorship opportunities that will be available. For inquiries, there's a number to call. That's 848-224-1201, or you can email info@kenyannurseusa.org. So whether you're a nurse, a healthcare professional, a sponsor, a vendor, a student, or a community stakeholder, this is one landmark event that you don't want to miss this September. Christine, are you going to be coming for this event?
She's an infusionist. She needs to infuse herself in there.
Are you going to be infusing?
Absolutely. I'm going to have a booth so I can tell Kenyan nurses open a business.
Oh my goodness.
She's a vendor.
So you are a vendor.
I haven't registered yet, but that's my intent. Mimi wa last minute.
Kuna vile pia si tunaweza kuja na vitabu zetu tuweke hapo.
So ukivend, hapana, hakuna mambo ya vitabu. So ukivend, kumbusha hao watu wa Kenya Nurses Association that you're doing it because you heard about it from the OneMic Show. Yeah. Yeah.
So when I was there when Dr. Kombe was telling us.
Oh yes, you are here on the episode.
Yes.
So wakumbusha, lakini usiende last minute, you might miss those opportunities.
Atasimuliwa.
Yeah, utasimuliwa. The vendor opportunities are limited, but it will be great to have you coming out here in Maryland on that weekend. It's going to be an amazing weekend. Now, the other thing here, I mean, there's so much that I'm learning here that now I'm even scared of even going to eat after this. You know, I feel like I need to fast
nyama
until
choma.
I figure out.
Think nyama choma. Think nyama choma.
Here's what you don't need to fear. I think we took the convenience culture a little too far.
Yeah.
I think we need to go back to respecting our food,
Yeah.
know your mama mboga by name. Even here in the US, you can find somebody, a small farmer somewhere around you, go to the farmers market. We just took convenience a little too far and we are paying for it. That's all.
Yeah, and the other problem is that Americans like snacking, you know, like snacking throughout the day. You know, like it's so funny, there's someone at work, personally I have a habit of fasting every Monday and Thursday, so I rarely eat at work, and I'm one of those people who can survive on one meal a day. So there's someone at work who once made a comment. He's like, I have never seen you eating, because you know, like people always have like cookies, you know, like chips on the desk, you know, like they have all
Some
kinds
sort
of
of candy,
things.
yeah.
So mimi wa sinaga hizo story.
You don't have a candy dish?
No, you know,
Ali.
sinaga hizo
Si
story.
ubebe tu hata tropical.
Yeah, hapana.
Nikulete.
Hapana.
That's why you're crying Westline party.
Yeah, hapana. Hizo vitu. No, first of all, me easy snacks.
Mtu andhiwa amenianza. Mtu andhiwa anione huko kule kwa bei.
Hiyo mwanane nyuma ya tent.
No, anione kule kwa bei.
Yeah. But you see, easy ma snacks, juu kama ma Pringles na nini.
Yeah.
Mimi, I thank God, you know, like, I don't know, at some
That
point
sweet
I started disliking them.
Okay.
I started disliking them. Vitu kama sijui popcorn. And all this other funny stuff that people eat. Because at work, you'll have people throughout the day.
Yeah.
Unamuona kuanzia asubuhi. You know, like ameingia, akona McDonald's yake. Then after McDonald's, akona things that they're snacking through until lunchtime. Lunchtime, they have, you know, like another heavy meal. Mm-hmm. And then after lunch, they have
Snack
other
again.
things.
Snackaroo.
Yeah.
Until
mpaka saa kumi.
exit.
Mpaka time ya exit. And then when they go home, they're also gonna eat. And then
no, they pick up something on their way.
They pick
home.
up something on their way home.
Yes.
Yeah. So I think that's part of the craziness that is there.
By design, that's by design. The craziness of eating that many meals. That's by design by the food industry because
Correct. Yeah.
Yeah, I remember.
So the advertising is geared towards eating 3 meals a day with a snack in between. Everything is advertised that way, so that way people fall for it and think that's normal.
I think I was watching is it The Corporation by Netflix?
Yes.
Yeah, we did that when we were, I think the class was the culture of capitalism. And then we had to work the corporation. And I remember we had this girl who used to work for Taco Bell. He quit that day. It was like, I cannot feed people what I saw there. So when Ali said he's afraid to eat, I was like, just go watch that corporation. And then you will know that we are not farming here like the cows, but they're being manufactured.
Hiyo corporation ni ile iko na kuku pia.
Yes.
Ile zile nuggets.
Yes.
Wewe bwana wewe
wacha ng'ombe wana scoop vitu kwa sababu digestion system yao is not made for that.
Sione hiyo. Ata chakula kuku.
Just go.
Sione hiyo.
No, me already started hating chicken when I came to the US because kukioku kuna vile it's set up in some type of way.
Yeah. And in fact, I think the one I watched was what's this thing called? Is it a 60 minutes? I think it was a 60 minutes on kuku na nuggets. And if you see how that whole line, how that thing comes out, hata we mwenyewe utasema there's no way my kids are eating this, I'm eating this, or seeing anybody I know eating it.
Yeah. Okay. Mika wanted to add something.
Go ahead, Mikasi.
I just said no. One thing you have to realize is that you have to realize that this a capitalistic country, and you ask yourself, how was I eating back home, and start thinking about that. Look for a butcher near you if you want meat, right? And then eat meat that you grew up eating. Endo ununue kuku ya kienyeji, endo ununue mbuzi. Go back to the food that you used to eat. You know, people look at our food and assume that our food is very calorie dense, which is not. Sisi kula chakula mingi. Tumezoea kukula ugali kubwa, nyama mingi, sukuma mingi. Like mili yenye si ukula mtu mmoja inafaa kwa mili ya watu wawili ama wawili na nusu. In a sitting, ka ugali kale kasari, kale kabolo kadogo kamejaa ugali, ati hiyo ni food ya mtu mmoja. Inafaa kwa food ya watu wawili au watatu. Tumezoea kukula food mingi. Hiyo ndio shida. Tumezoea kumaliza chakula kwa sahani. Hiyo ndio shida. Kukichapa chapati 3-4 na sitting. Hapana bana. Shabu unakula moja. Alright. So the thing is, if you yeah, but I usually tell this people. I tell Kenyans, no, one be to Africa.
Yeah.
If you wanna lose weight, if you're serious that you wanna lose weight, do this. Your breakfast, toa mkate. Chukua ngwashe nduma waru, si ndio? Chukua ngwashe nduma, hizo ngwashe nduma, boil mayai, kula na avocado, na chai. Strungi.
Yeah.
Unaona? Aya.
Sawa. Hapo
kama utakula lunch, lazima ukule lunch, unasikia lazima ukule lunch. Kama lazima ukule lunch, chukua mchele. Right? Kombe moja mchele. Hiki kombe moja mchele utakula mara mbili. Hiyo kombe moja mchele huwa kuku. Right?
Okay.
Hiyo kuku kienyeji, iboil, kata vitunguu ni karange na mafuta yake yenyewe. Ukitaka dry fry na mboga. Kula hiyo. Hiyo ni meal fit. Usiku kama ni mtu wa sembe lazima ukule sembe, kula ugali lakini kula kangumi kadogo kwa ugali. Kula na nyama dry fry, hiyo nyama umekata ikajipika na mafuta yake, kukata vitunguu na mboga. Portion ndogo na avocado. Like kama unakula meal 3, unaweza kula hivyo meal 3. Ofai kukula hizo meal 3, unafaa kula meal 2, utakuwa sawa.
Kula ugali foundation maka ya samaki.
Unaona, kula food yetu vile inafaa kupikwa, usikule food yako na version zingine. Ili pali watu waribu, unajua pali watu waribu ni nini? Mtu anapima pasta, anapima kuku. Alafu anasahau kupima cheese, anasahau kupima nini, anasahau kupima hizo ni calories anaongeza. Wewe unaona umepika chakula healthy, Juliambo hiyo recipe kwa siji ina how many macros of proteins. But umesahau hizo zingine unaongeza bado ni calories umeongeza. So you end up overfeeding yourself, unaona. kula food yetu, pika vile inafaa kupikwa. Reduce portions, utakuwa sawa.
Wala diet coke na extra cheese.
Sasa
okay.
Bandio usiniangalie.
Haya, sawa. Watch hapa tusome a few comments and then we're going to go back to Christine. Sharon Mumbi anasema at least US is regulated for the most part, Kenya not so much. Felista Nduta from all the way from Kenya anasema very informative conversation. Anasema it was Macron who was on the balcony na Ombachi. And then Kevin Kute anasema this is especially prevalent to folks who work late shifts because folks also eat to stay awake at work. Okay. And then hapa
huyo ni mtu wa New Jersey anaongea hivyo. Huyo ni mtu wa New Jersey anaongea hivyo.
Alafu hapa Felista anasema I could go for like 2 days without eating. Lack of appetite, does that mean I am safer? My goodness.
Yeah, like
how do you go for 2 days without eating?
Hiyo umesema waistline hiyo ni ngapi?
30.
No, haikugonga 30.
Yeah, no more.
Squeezing is 34.
Yeah.
34 ndo minimum.
Yule nafikiri uko 16. Maybe that's why.
Huyo ni 1 gigabyte. So
goal ni waist 24.
Yeah. 1 gigabyte. I don't think hata amagonga.
And then Ruth anauliza swali lingine. Ruth anauliza why eat ugali at night? I mean, what kind of question is that, Ruth?
Surely. It's a sleeping pill. I mean, this is part of the whole way you want to sleep, you take the ugali. I mean, what is there?
Where now, Christine, when you say Kenya is adopting America's food system, maybe what specific changes are you talking about? You know, kuna ingredients, is it farming methods, is it processed foods, is it portion sizes, is it marketing, convenience, or is it just all the above? Christine?
I think it's all the above, actually. Yeah. Go to a Kenyan supermarket today, it doesn't look any different. Like the inside aisle with all the colored food and all the colored package, it doesn't look any different from our supermarkets here. If we know the GMOs are the same, the same people providing here, the same ones providing us with it. The fertilizers are the same. Maybe they might have a different name from here. It might be called Roundup, and then in Kenya it might be called something different.
Correct. Yeah.
They are all the same. So the big players, the ones who at the end of the day are benefiting from keeping us down, are the same names. Therefore, we're going to be getting the same problems.
Now, for right now, you know, like, because now we're even now starting to think of ourselves here. You're making us think of ourselves. Tuache hata nyumbani. Like, because the food supply here is so tainted, you know, like, it's almost everywhere you'll find these foods. Is there value, you know, like, shopping at places like Whole Foods, Trader Joe's, and these places that label themselves as organic markets?
Let's take Trader Joe's off of the list, because so many reports have come in. No, Trader Joe's is good. I was thinking about Aldi's. Trader Joe's is okay.
Aldi's, yeah. Okay.
Yeah. So not Whole Foods.
Yeah.
Already has a whole bunch of seedless. So even in Whole Foods, you have to go read the different foods you're getting. It's not going to be a lot of all 100% organic. Whole Foods is not organic. So a lot of the foods in Whole Foods you still have to go choose. Remember, the organic on the grocery in the little label starts with a 9. You know the numbers. It's like 94081 on every food you buy. Inakuanga na label.
Yeah.
4 numbers or 5 numbers.
Yeah.
If it has 5 numbers, it's organic.
Yeah.
Well, they say they've certified organic.
Wow.
And if it has 4, then it's regular conventional. So that's how even when you go to Whole Foods, you'll get the 4 numbers and the 5 number vegetables. So you still have to read. You can't just go shopping blindly at Whole Foods. When I went to the bread section the other day at Whole Foods, my bread still had like 14 ingredients instead of 5 ingredients. Bread needs 5 ingredients. Why do I need 14, 16 ingredients?
Because they have 10 different types of seeds, and they are all in there. So
Nasi your seeds. Seeds will tell you sesame or whatever seed. You know you're getting a seed.
Just work with us over here. I don't know why you're over here fighting
So,
us.
I didn't come to
Christine, tusaidie na wakina Ali ambao wananunua salad McDonald's.
Oh.
wanashikwa na hiyo inaitwaje?
Mac salad is healthy.
Ngoja hii.
Mac salad is healthy.
Sahi kuna kifafa ya salad.
Hao ndo wanashikwa na hiyo explosive diarrhea.
So Mac salad is healthy.
Wow.
No.
Jaribu tu uone.
Yeah.
Jaribu.
Ethically, you like this is what we are talking about. Forget
Yeah.
about convenience and start having a relationship with your food.
Yes.
So when you go to McDonald's and you look at that gray-looking meat that comes in between your sandwich,
That shit is horrible.
does it look like something you should be putting in your body?
No, not at all.
No.
I mean, the one you normally get is brownish. So even that one, you said gray.
Like brown gray.
Hapana, Omera. Which glasses were you wearing?
Have you ever seen any blood coming out of McDonald's meat?
Okay, you know, if we can even start talking about ile fry yao. Ile fry yao unajua iozagi?
Yeah, unaweza kuacha kwa gari for 1 week. You can leave it in the car for 1 week. Na haiozi.
A year.
Yeah.
Aiozagi.
So
If it
that
falls under your seat, you'll find it next year.
Yeah.
Looking
The same way.
now you know, Christine,
Okay, lakini nyinyi watu bana. Sasa,
what I'm more worried
what can one
about
eat?
is food that we are giving to kids, or foods that kids are now kind of addicted to. What are the big ones that should be avoided?
Without mentioning names or something?
Yeah, no.
Nuggets.
all of them.
But I can see them come
Nuggets.
soda.
But
Nuggets is the
what do you
first
mean
one.
all of them?
You see how Micah said we need to go back to eating basic the way our grandparents used to eat.
Yeah, like in your kids, that's what they're trying to, that's the label. It's like, nyinyi watu wa Afrika, nyinyi watu wa mnakula hivi.
Yes, this
when you go back, there's like unaturudisha kwenye primitive era.
We need to go back to the primitive and then start relearning what food is and who's making our food and what they're benefiting from feeding us these foods.
Yeah.
A lot of the kids today, you see, most of the kids are very, very hyperactive. Right?
Yeah.
A lot of the kids are getting diagnosed by many things. By the time they're in kindergarten, they've already had a diagnosis.
Correct.
And baby, daddy, mommy cannot get off the chair because baby, daddy, mommy is eating everything in your pantry that they should not be eating. All those snacks those snackables, the lunchables, the sijui nini, hizo ndogo ndogo.
Convenient.
All of that convenient food
Yeah.
is keeping your children sick. And then now we return to Big Pharma. The moment your kid goes to school jumping up and down, the teacher is the one who is going to recommend Ritalin or, get the... So you see how...
ADHD. Huyu mtoto ako na deficiency.
Yes.
Yeah.
Now wakikataa ADHD watasema mtoto wako ni bipolar by the time your child is 5-6 years old.
It's
Okay.
sad.
Now, Secretary of Health ajasema bado.
Hey, wachana no Secretary
Na
of Health.
huyo.
Now, some comments here. Felista Nduta anasema I've been 56 kgs all my adult life. So I think ni hiyo hapo kwenda 2 days without eating. And then
alafu unajua muulize tu kwao what they grow.
Yeah.
Ask her what they grow huko
but
kwao.
Felista, what she needs
Felista
to
anaweza
do.
kana mpaka 3 days ajala. Si ndo amesema hapo?
Yeah, but like
Hiyo hata featherweight haipo kwa boxing.
but we welcome her here. Akikuja hapa.
In a safe space.
Yes, we're just giving her like
Yeah, that's the
6 months.
real test iko hapa.
Real test iko hapa.
Yeah.
Real test iko hapa.
Huyo tulisema 6
Yeah.
months waist up by 6 inches.
I remember
Standard.
like when
Mwambie avute bangi anashikwa na appetite.
Mika.
Yeah.
Anajaribu kudiagnose nini? Avute bangi atashikwa na appetite.
Maybe hiyo bangi yake ndio mbaya ndio maana.
I personally remember when I first came to the US, my first license niko nayo mpaka leo.
Ulikuwa na how much?
146 pounds. I was 146 pounds. Yes.
Yeah.
My first license.
And this goes back to what I was telling you about how we looked when we arrived.
Yes.
We were slim and
Yes.
severe.
Ali alilose weight on his way here kwa sababu ya kuogopa.
That could be true.
I was,
But 146 bado.
I was,
I mean,
yeah.
but wait, 146 over 20 years ago.
Yes.
That's nafikiri that's
No, but someone who's 20 years younger than me.
but
Lakini unajua nini?
146. Bado ni mtu mdogo sana.
Ngojeni niwaambie kitu moja ni usahau about to lose weight, right? Weight ikwangi gained in a day. Ukwa ni an accumulation of your lifestyle.
Yep.
right? So unaweza kula healthy na we ni mlezi, utanona bado, kwa sababu it's all about a balance of what you're bringing in and what you're taking out, what you're bringing in, what you're burning out. Yes.
Now,
so tunaweza sema alafu pia angalia vile life yetu imekuwa. The more older tumekuwa, the less tunatembea, the less tunafanya nini, the more tuko kwa gari, the more tuko kwa tumekaa. Hata gym yenyewe uendangi, ukienda gym unatafuta gym yenyewe kuna sijui jacuzzi, pool, uenda kuchill badala ya kuinua chuma. So basically you look for ways of being more lazy than when you uko lazy already. So yes, chakula plays a really big role in it, but fear lifestyle. I love kiroro. Kila siku before lalo napiga tu glass tuwili ama tuchitubia tuwili. Friday kifika unachafua 24 paka mzima, chupa mzima. Saturday tena, Sunday tena branch hapo, alafu umeenda man, ile calories umeongeza tu na hiyo pombe utanona, right? Okay. So kuna as much as unafa kitchen, ufix kitchen, which is the most important place, lazima ukule vizuri, pia wewe unafaa kuchange lifestyle yako. Otherwise haita work out.
Yes.
Na Marekani pia kuna constipation kubwa.
And especially one simple thing that a lot of people can do that people don't necessarily do is just walking. You know, like at the very basic, ukiweza kuchapa kama at least 5,000 steps daily. 10,000 is good.
My friend.
Yeah.
Kutembea ndo Zempic.
Yeah, kwa sababu
watu ni zangasiri ni hiyo.
Yeah, kutembea makes a difference.
Yeah.
Maybe upiga 2 hours of walking daily.
Yeah. You know,
doesn't matter what it is. 2 hours doesn't matter. Kila siku lazima nichape karibu 10 to 15,000 steps.
Unajua mimi nilijua nini ina make difference because kuna kipindi nilikuwa naishi mtu ambaye yuko diabetic, right? Na alikuwa akichoma akipima will be around 200 something. Alafu watamwambia panda ngazi mara 3 na kushuka kwenye same building, right? Alafu akirudi ikonomo, and I'm like, if this 10 minutes imebadilisha hivi
10 minutes only,
an hour every day, you know, ina make big difference ambayo huoni, because hata hapo akienda na kurudi yeye mwenyewe feel much, lakini ukipima you can see kwamba okay, sugar ime stabilize kiasi gani. So I think watu wakiweka desturi ya kutembea like for an hour a day, 2 hours.
Yes. No.
Alafu kitu moja watu waelewi na kutembea ni as much as it's good for your cardiovascular na nini, it's good, it's the best thing you'll ever do for your mind. Kukua tu uko nje na hizo kelele, like umetoka from kelele zako za kawaida za simu watu nini, just walking out unasikia kelele hizo za pip magari nini, ndege nini, like lost in your thought, hata kama unasikia ngoma ama nini. That's the best thing you'll ever do in your mind, giving it a break from everything and walking outside.
Yeah, na alafu pia walking, you know, like after meals, like maybe 10-15 minutes after meals. You know, like just giving a 10-15 minute walk makes a very big difference. So that's a simple thing that you can do. You don't need no you know, plan ya gym ya sijui lifetime athletic iko na jacuzzi na nini. That's something very simple that we can do.
Kuna swali hapa.
No, gym ni muhimu, watu wanachuma.
How many pounds are you nowadays, Ali?
Nani anauliza swali bwana? Hiyo ni swali.
That
is a personal.
He came at 140. He came at
wewe ndio ulifungua.
Aliingia at 146. Sasa hivi yuko
ameongeza 142.
No, yuko 164.
Ameongeza 142.
Add 164 to 146 and get the medium.
That is a personal question. That's like asking a woman their age.
No, it was personal. It's not personal.
Hey, I know, by the way. Hiyo swali ni kama kuitisha. Na ujue, by the way, I was 146.
I think kuna njia mbili za kujibu swali.
Yes.
You either give the number au utoe shati.
Okay. Aya, sawa. Nyinyi sasa, you guys are getting this. Yo ni sana. Show inafaa kwa imeisha. Anyway, let's go back to Christine before to kwa sidetracked hapa. Christine, now people use words such as organic, natural, processed, ultra processed and GMO as though they all mean the same thing. like what's the difference between these words and why is it important to distinguish, one from another?
Okay. So some of these, organic does not always necessarily mean fertilizer free or other chemicals free. It's just their choices of what they use are easier to use. Organic is typically more small scale, because organic food waribika. And pesticides will like it, everything will like it. Okay. Then there's conventional. These ones, they just use a lot of fertilizers, a lot of many other, but they're not modified. It's heavy on the use of other assisting factors like fertilizers, pesticides, and all of that, which are stronger. Then there's the ones that are modified, like somebody had to go do something to the seed so it can look different, and it's going to completely grow different. Those ones are like a whole different organic. Modified.
Genetically modified. Yeah.
So that one, somebody has to touch the genes to change it, and it comes with its own set of problems. Ile gani ingine ulisema natural?
Kuna natural ultra processed. Kuna organic, natural processed, ultra processed, and GMO.
Mi wakishaanza kuprocess washa process.
So
I don't know. Yeah. Really, I can't speak much to the processing, the ultra processed. All I know is once they've altered and processed the food, it's just different after that. Maybe somebody else can take on that part.
Oh, okay. But now, besides that, regarding the conditions that you're seeing more frequently in America, that you believe Kenya should be trying to be wary of or trying to prevent now, which are some of those?
Hizo food tunasema hizo processed, even though I don't know what they do to change it chemically, but the processed foods, which typically processed foods will come in a package with very high shelf life. Ni kama hizo food zinaweza kaa for a minute in the package and you can move around with them, right?
Okay.
Those are the processed foods.
Like chakula Kenya kinaitwa Indomie.
Yeah, I know. I saw that in Kenya and I was like, what? Because I never knew that those things were in Kenya, but ziko sasa.
Hiyo alafu inaitwa siji sauce.
Kwanza the sodium level.
Yeah.
Those are problematic foods. Anything that's packaged for you.
Alafu cereal.
Frozen.
You guys, when you grew up, cereal ilikuwa mnakula ilikuwa nini? Ilikuwa cornflakes na Weetabix. Yeah. Siku hizi angalia the cereal as in those ni leno moja refu hivi imejaa hivi.
All different size colors and it's madness.
Kwenye mayai.
Yeah.
Kuna organic, cage free, pasture raised. I'm not sure.
Kuna zile ziko nyeupe na kuna zile ziko brown.
Hiyo ameambia kwamba it doesn't matter.
Yeah, it doesn't matter.
No, ila naulizia hii.
It doesn't matter.
Yeah, organic.
Kuku mwitu yenye metembea.
Okay, tell us
mayai zao wanga azikwangi kala same.
Yeah, different colors.
Okay.
Like kuna moja kuna ka blue, kuna ka white, kuna ka gray, kuna ka like as equal same.
Yeah.
Because it's depending on what it has eaten that day.
Okay.
Sasa mimi nazungumzia hizo za kuambiwa this is organic, nyingine iko stamped as cage free, nyingine iko pasture fed or something.
Mayai iko na issue, Christine?
Yes, everything. So coming
Ali atakula baada ya hapa.
Ali, I told you about nyama. Sasa wewe umeenda ukaleta mayai na unajua hizo ni vitu si waga tunakula daily basis. Kwa nini uko hapa?
So yes, just kama kuku yako imereiziwa na padu, mayai yake itakuwa gani?
Yeah, padu square.
Padu eggs.
Yeah, it will be the same sick eggs you're going to get from a sick chicken.
But we won't eat the yolk. We'll eat the white.
Still.
Yeah. I don't know if in the process of the egg becoming the egg that they separated the DNA like that.
We were told the white one is the one that's good.
Na sasa, what about like meat? Because Kenyans are also very meat heavy. Kuna hizi nyama za kawaida, hizi za our ng'ombe the cows that were stunned or the cows that were actually, like cage-free, that were slaughtered. Like is there a difference between meat in terms of what people should be cautious about?
The way the animal is put down.
No, I don't think nyama ni nyama either.
Yeah.
Nyama si nyama.
Yeah.
Whatever the animal is eating is going to manifest in your body.
Okay.
However your animal is raised, and this includes spiritually properly, is going to manifest in your body. Farming practices na ujinga za watu zinaweza fanya wale recipients
mashetani
aka customers.
Yeah.
Okay, so mimi swali hapo. So assuming I don't know whatever how this cow was raised, slaughtered, whatever, the way I prepare my food, is there a better way saying that if you don't know, if you're not sure about what you're taking, maybe don't barbecue? I remember we had the thing about carcinogen and all this stuff, right?
Wait,
so hold on, almost fire. Hold on. Okay. Hold fire, almost fire. Will it make a difference if I'm getting this nyama, the same nyama from Purdue, nikaeka kwa grill, nikaeka kwa air fryer, nika deep fry na kuibake?
I think the way your food was raised is very important. I think that becomes the end all be all. I don't see how you can cook away the chemicals.
Well, not to eliminate, but is there a safer way or a safer
to consume that which you don't know?
Consume inorganic, a safe way to consume poorly. I don't think so.
Yeah.
The only thing unazaifanya ni kuiongeza ni kuiharibu more, like deep fry,
sasa umefanya chemicals
uiongeze deep fry sasa
unakwenda na wazee wa madugu dicho, dawa ya moto ni moto,
wengine
dawa ya moto ni moto.
Sasa
with things like fruits, you can say you can wash more deeper.
Yeah.
With things like fruits, you can say like there's a dirty dozens which there's some that we should not be touching. So with I can say, but
this you can only remove what has been sprayed on, right? Like you come on fertilizer, but fertilizer and stuff you bado utakula, right?
Infiltrate ndani ya fruit.
So Ali, wacha
Yes,
nikufundisha kudifferentiate nyama.
All right, here we go.
So grass fed, nimekula tu vegetation, nyasi nini, mafuta yake kwa yellowish. Grain fed, hizi zenye si ukula za America, labda zinapelekwa zinanoneshwa before zichinjwe. Hizo zinapelekwa fattening, mafuta yake kwa white.
I didn't know
Hold on. Mafuta as in what? Tukiakaanga au?
Yeah, the marbling on the meat.
When it's nini.
Yeah, sasa my friend tayari nimeshachemsha.
Hapana, before we pick it. Before we pick it, like when you buy the meat.
Okay, lakini kama nimeshanunua my friend.
The fat.
No, si kununua, ukienda kununua
ndo uangalie
kwa bucha ukiangalia, ukiangalia mafuta.
Yeah, because
na ile ambayo inatoa mafuta.
Siku hizi pia kwa halal store, kwa halal stores, there is a preference to, like grass fed. And it is a bit more expensive.
Okay.
Than grain fed. So but kuna preference.
Ali, nenda kaangalia ile documentary corporation.
Inaitwa corporation iko Netflix.
Iko Netflix. Nenda kaitafute uone unakula ng'ombe ambaye
Ama
tangu
ng'ombe
amezaliwa
mpaka
amekufa hajala manyasi. And because tumbo lake limetengenezwa kufanya ale manyasi, kinachotokea ni kwamba sometimes they have to scoop stuff out kwa sababu haziwezi kutoka katika tumbo.
Okay.
Na ndio maana naambia kwamba we are not raising, we're not farming, we're manufacturing hizo ng'ombe. Kuku wa miezi.
Oga dairy cows, unanga kuna zile dairy cows uko hapa kwa tumbo zimewekwa ile kitu ya kutoa gas. Jia chakula zinakula. Zinafura mpaka
It's called feed, sir. Feed.
Okay. A few comments here. Washeke hapa alikuwa anasema Whole Foods went downhill when it was acquired by Amazon. Ruth Kilungu anasema ugali is for hard work, not to sleep. And then Sharon Mumbi anasema banana sticker 94011 is organic, 4011 is not organic. And then Sharon Mumbi says when we know better, we do better. Ruth anasema Indomie, the brand is in almost all countries in Africa. This is very, very sad. And then hapa Washeke anasema Unilever and Nestle anajaribu kuzisensa, but we can read are scourge to Africa. They poison us from infancy with sugar added in baby formula. Yeah, and actually Wanjeri had asked a question about baby formula. You know, like apparently there's also an issue with the baby formula that's being distributed in Kenya, in African countries. I didn't know that.
Cerelac actually, for Nestle, it was such a big scandal. The amount of sugar that was put in the Cerelac that they were selling in Africa. Yeah, it was a very big scandal. Okay. It was actually, I think, on BBC.
Yeah. Na Hanigal Njeri hapa anasema I heard the food industry is working on making GLP resistant food since the packaged food industry has taken a hit. So yeah, so you know the story. Now, Christine, before like we get closing to wrap up, which diseases should be concerning, that have been there in America, but you're now seeing an increasing prevalence in Kenya because of this change in diet patterns?
Okay. We can start with obesity, and obesity comes with a whole myriad of problems. So all obesity-related ailments are now becoming a Kenyan problem because, like Omosh said earlier, years ago we were never this fat coming out of Kenya. But these days, there's serious and honest fat people. We were not just honestly, and then so that with that comes heart disease, diabetes. Diabetes comes from the food and the chemical too. The heart disease, what else do we call it? All these chronic illnesses we spoke about. The stomach illnesses that we talked about, like the colitis and the Crohn's, all of those are going to come.
Joints issues. Joints.
Yes, absolutely. Kwanza sisi tuko na gout. Gout, sisi tutaletewa dawa ya gout ya infusion pale haraka sana.
Wow. Okay. Now, and kuna hii issue pia where people are saying there's a difference between saying pharmaceutical companies profit when people are sick, and then those who are saying they deliberately make people sick. So is there any evidence that takes us from the first statement to the second one, where they're just profiting because people are sick? They did not make people sick. But then now there's this one where people are being made deliberately sick.
Let's look at the biggest pharma guy we know. Who is it? Bill Gates. Bill Gates is in charge of your fertilizer, is in charge of your seed, and is in charge of your medicine. Now kindly make it make sense. How?
And in charge of creating mosquitoes.
And in charge of creating mosquitoes and in charge of everything. So you kindly tell me, how is it gonna cause? But somebody.
And he actually owns the most farmland in America.
In America now, after killing all those Chicago farmers, Illinois farmers, I was telling you, they come and buy the land en masse because the farmers default on the loans because they're sick. So Bill Gates and his friends are the biggest land owners in the U.S., farmland owners in the U.S. But yes, I believe the pharma is good. It has a lot of benefits. I've seen miracles happen to a lot of my patients. It's the players who come in, the doctors, the healthcare practitioners who come in and kind of mess up with the way the system should be working. If we are really about healing and not about profit and capitalism.
Wow. This is so, mind-opening. Now, swali ya mwisho, you described Kenya, or rather you described growing interest in Kenyan healthcare as a gold rush. Why do you see that primarily as a warning rather than an opportunity?
If you
don't worry, your big pharma is not listening to you, so you can talk to us.
Am I safe to speak?
You are safe. You are safe. They do not know we are here.
It's a problem because here, we up to a few years ago, we had some semblances of checks and balances. We had the FDA, the FDIC, we had all of those people. In the past, like maybe 10 years, they are also eating bribes like anybody else. So nobody is controlling, okay? The food that is being allowed into the market is not being controlled, and we can see it. The reason I'm concerned about Kenya is because we are, number one, we are a target because we are one of the smartest African countries and one of the loudest African countries with a very smart young population. When you see these people always coming to offer us help, you know there's something they're gaining out of him. So all you have to do is look at the businesses that they do and know exactly what they're bringing. Look at the way they've treated their own people here and know that we will not get the same grace on the other end because it's all about profits.
Wow.
So we have to be the ones to choose to be careful on who we allow to come help us decide on how we're going to feed ourselves for the near future.
So as we walk out of here today, maybe, for ourselves, what are some basic things we can do for us and also for our families that are back home, like immediately within the next 2-3 weeks to implement
4 days,
so that we don't have to come and pay you 140K to give us infusion?
Absolutely. My biggest word of this year is detach. You're gonna have to detach yourself from the beliefs that we've had around food for the past few years, because this is not old. What we are doing right now, we 30 years ago, 20 years ago, we were eating right the way we are supposed to. So we are gonna have to detach from these new ways that we've learned, these bad habits that we've learned, and go back to basic. Build from your grandma's menu. There was nothing wrong with that menu.
So by detach, which are the worst habits that you're seeing now common, like when you go to Kenya and amongst Africans here in the US?
The snacking, the fast food, the ordering things from
DoorDash
na vitu kama hizo. We let go of the basic relationship cooking at home. And we say we don't have time. I believe some of us be working a lot of hours, but most of us just want to run home and scroll. We are not making time to do what is right. And we have to make choices. Less screen time and more choosing what should be going into your body. When you're on that screen, do research about what's in your cabinet. You can go clear your cabinet. If you look at all your packaged foods, there's gonna be a little bit of thing down there that says includes bioengineered something.
Okay.
If you look at your food pantry, almost everything that comes in a package, including bread, will have that little footnote, includes bioengineered ingredients or something like that. So you have to make serious choices for yourself when you go into the grocery store, when you go to see your doctor. As far as we were talking about big pharma, kuna miti shamba. Before you get sick, get used to going back to root medicine for building your system and your immunity before you get sick. You can go back to the old ways where we just used to drink morubaini after a while because you need to do a cleanse.
Ginger and garlic.
Dr. Naman si alikufa. Who are we going to?
Nataka nimuulize. So, Christine.
Yes.
Nipe menu yako ya Saturday and Sunday. This coming Saturday and Sunday.
Menu.
Yeah. Unakula nini? What's your regular?
What is on your table?
Are you practicing what you
What
preach?
is on your table?
I'm just curious.
Up until recently, I was a terrible fast food eater.
Okay.
Because of that working and being always on the road, so I just grab whatever I can grab. This day is mwili natetemeka nikipita kando ya McDonald's, so I wouldn't even touch it. But personally, I'm lucky because I don't really care about food. So me, nikikula rice and beans, I'm really happy. Nikikula lentils and chapo, I'm really happy. Nikikula like very small portions. I don't have a problem with picking foods and the meat and all of that good stuff, because for me, food is not a big. I eat to survive, not because.
Ugali na nyama fry.
Because I mean, no, the reason I'm asking
I don't
is
even
like
meat. I can do without meat. I can
Unaona?
no,
Mumesema tema nyama. Mumeenda kwa nyama.
I feel like process sasa hivi you know, it's like flying from DC to Virginia, you know, it's like 2 hours za kupita kwa security and then like 30 minutes za kufly.
Yeah.
So ile process ya kupita kwa pantry unaangalia 4 number 5 number unaweka hapo 5 number 4
9.
number.
Look for 9.
9. Yeah, unakuwa
nikupatie menu yangu ya kesho.
Okay, okay, tunaanza na brownies alafu
Mika tunajua.
Tunaanza asubuhi kahawa. Alafu tunakula mayai boil.
Mangapi? 6, 8
na ndizi 4 tu.
Okay.
Na ndizi.
So
alafu at some point tutakunda nini, nakula Greek yogurt na berries. Alafu sasa mili yangu na ngoja mili yangu nakula baga 2 kesho na grill.
Hey.
Najimekia baga
carcinogen.
Yes.
Wala kama ni carcinogen.
Okay.
Endelea.
Najimekia baga 2, hizo baga 2 alafu nita air fry waru moja kwa chipo. Kwa nini kuanda chipo za waru moja kwa air fryer? Hiyo ni mili yangu. Na hiyo mili yangu yote, hizo food zangu zote zenye nimewakauntia ziko below 1800 calories.
Yeah, hizo ndo sifiki huko kwenye calories.
Okay.
So wewe ungekauntaje hizo calories wewe? Kwa portion zako ungegonga 4000.
Nafikiri kwenye next program tuje tuangalie kwa sababu kuna mambo mengi sana pia ningetaka kuuliza. Kuna zile beyond meat umechakula
I know. Hizo by the way.
Hiyo nimesema tu. That's for next.
Hizo ndo gani hizo by the way? Me I've never tried
it. Beyond. Hata wamesema inaenda, hata sasa hiyo wanasema imeenda beyond. Imeenda beyond.
Nyama za majani. Okay.
Wacha niwaambie kitu.
Na maziwa soy.
Soy milk.
Yeah. Hapo.
Remember, soya is one of the most GMO produce out there, and a lot of these Beyond Meats and sijui kina tofu na kina nani, they're made from soy, right?
Yeah. Okay.
Wacha niwaambie kitu moja hapa. Vile nilisema, think back to your ancestors, right? Mababu zenu na manini zenu, right? They were hunters and gatherers.
Hapa ni okra tu ndo itakuwa menu ya kesho.
Ngoja, they were hunters and gatherers. Most of their diet ilikuwa ina constitute na meaty, fishy diet yenye na mixiwa na vegetables. Walikuwa ni watu wana move.
Yes.
Most of the time. So hakukuwa na permanent places. So agriculture was not something that was too much there. So when you turn yourself to a vegan diet kabisa yenye unaacha na nyama, kuna nutrients yenye you're leaving out of the table. As a human being, you're supposed to be moving and you're supposed to eat a balanced diet.
Yes. Okay.
Usikule kama ng'ombe na usikule kama simba.
I believe you can get a balanced diet from all vegan if that's what you choose to do. You do not have
you can. I'm not talking about that, but I'm also saying I'm just saying in parts of there's some type of like something like getting collagen. There are things that can give you better quality of collagen than getting from a certain way.
Yes.
Like I'm not fighting anybody can choose how they want to eat. Mimi kifika kwa diet mwambia mtu mimi diet yangu ni seafood diet. I seafood I eat.
Okay. So unaona.
So mwambia mtu kula kenye unataka lakini jua ni nini unaingiza ndani ya mwili wako.
I mean clearly, you know, like we eat excess meat. And there's places where they excessively don't eat meat, you know, like in certain parts of India, and there's no deficiencies towards that. So of course vegetables can get you, you know, like the protein that you need, but ni kama pia vile, you know, like unaweza you can travel 20 miles by car, you can also travel by a bicycle. You know, like it's much more difficult traveling 20 miles by a bicycle, but it will still get you to your destination. Real quick, one word answers here, Christine. One Kenyan food we should preserve. Moja tu that comes to your mind.
Kenyan food. Ugali.
Ugali. Okay. One modern habit we should reconsider.
Driving everywhere or riding everywhere, we should walk more.
Okay. One health screening most families postpone. All.
Yeah.
Annual care. Ile yearly, ile ya kila mwaka, ile ya kila mwaka.
Nimeona
No, actually hata hiyo once a year watu wengi hawaendangi.
Aya, one word. Hizi ni one word answers. One question every patient should ask before accepting medication.
When can I get off?
Okay. Oh, that answer. I love that. That. Yeah. One misconception about Big Pharma.
they don't pay good.
That they always have the patient in mind. They are capitalistic first, and then you come last.
Okay. And then one misconception about traditional medicine.
That the others are superior to it.
One warning for Kenya.
We have to go back to smaller, older ways and recalculate.
And then lastly, one reason for hope.
We can't give up. We are still here.
Okay.
Yeah, unajua umesema one test ambayo watu wana postpone every year.
Yeah.
Yeah, nimeona clip moja huko Nambale. Yeah, to do HIV screening waliletwa wadada wa Kikamba wakawa promised.
Yeah, niliona hiyo hapo. Yes, I saw that.
Na wanalalamika kwamba mmetuuzia mbuzi kwa gunia. Yes, tukifanya screening tutapata dada wa Kikamba.
Yes, wakakuja wakafanya screening because waliambiwa madada wa Kikamba wataletwa. I saw that was
kwani
very.
Wana nini?
Yeah. Anyway.
Okay.
Yes, that's another one.
Hiyo story nyingine tuwezi ongea hapa kwa radio.
Haya, Mbelwa, wahenga wanaelezaje?
Wahenga walisema kila kilicho na mwanzo hakikosi kuwa na mwisho. Kwa niaba ya OneMic tunasema meli imetia nanga. Mika, karibu baba.
Nimependea jina sana. Anyway, it's summertime and the sun is shining. Sun is shining. Kuna mvua. Wow. Kuna mvua mingi. But anyway, I want to thank Chrissy. Thank you for joining us. Thank you for coming us and educating us today and being able to join us in this conversation. I want to thank my fellow co-hosts for joining us. And I want to thank our listeners, wachangiaji wetu. And I just want to ask everybody out there. I know it's summertime, back to school, iko karibu, people are doing whatever they're doing, but I'm just saying also, remember, breathe. Alafu angalia mtu yuko kando yako, mwambie unajua nini? Itakuwa sawa. Alafu tuendelea maisha. Because tunakapitia, but itakuwa sawa. Anyway, enjoy your weekend.
Thank you, Mika. Almost fire.
Asante sana Mikasi. Just want to send a big shout out to all my fans and thank you to our guest host, or should I say our guest today.
Shmi.
Yeah, I was me. Yes, I was me. Thank you very, very, very much. This has been enlightening. To me, I think this is part 1 of 5. And by the time we get to part 5, we'll be growing our own food in the back, and we'll make sure we are the ones who manufacturing the seeds. And yes, and our waistlines will reduce to the ile dhate tuliingia nayo. Ile dhate hapana, hiyo ya Felista is too much. We can't.
2 days. No. Unakaje 2 days bila kula? 3 days.
Amesema 2 is normal for her. So that means anaweza enda mpaka 3.
I mean, is it a famine situation?
I think these are questions that you can ask her. When you yes. Na yeni 1 GB, so you can only imagine. Maybe food is not in her WhatsApp group. I don't know.
But maybe her fast bado anakunywa maji. Because ukinywa maji but still 2 days. 2 days is still 2-3 days is still tough. Yeah.
Okay. Kwa nini wala kwa Bible?
I don't know. Tutaiacha tu hapo. Mikasi
ndakuwa fasting is really healing, eh?
Yes.
That 2-3 day fasting that she's doing. Her body must be clean, a good one.
Oh yeah?
Yeah.
We don't know what she's doing in those 2 days when she's
Usiambie watu hapo utafanya alia kufenja hapa
akitafuta waste ya kukuja kutoka Ali anataka mafuta ya brown.
No, you know because niko na experience ya fasting.
Yes.
When we do that 30-day fast,
correct,
like
you always
very easily you lose 10 to 15 pounds.
Yeah.
Very easily, you know. And then unajua, like when you fast also, there's a way in which you feel yourself lighter, you know, like even when you're moving na nini, you feel yourself very lighter. And then when you do that fast, iyo siku, you know, there's an assumption people wanakula sana. When you fast a whole day, especially kama hii, if you're fasting in the summertime, when it comes to time for eating, mentally you're thinking that utakula because unanjaa sana, but when you start eating, there's very little food that you can eat.
Kanini ya shrunk.
Yes.
Yeah. So,
So
that's it for me. See you guys next week. Asanteni sana. Have a good week. Enjoy the summertime. It's cool down in the East Coast kiasi. So pia muji enjoy. Mikasi nitakuwa hiyo area ya Ronok kesho. So see me on the side as the ref waves play on. I'll see you.
Okay, all right. Asante sana DJ Omosh Fire. But let's go to first Christine for her parting shot.
Guys, we cannot give up. These things is just a few people who are trying to overpower the rest of us. We have the power, we have the knowledge, we have everything we need. We have to do right by ourselves. We have to choose us. So we can't give up, and we cannot lay down and let them take over like we don't have any power in it.
Okay. Yeah. All right. Thank you so much. Thank you so much, Chrissy, for coming through. This was a very mind-opening episode. It's a kind of episode that gives you a lot to think about and makes you think of things that you want to start changing right away. Not only in your personal life, in your family's life, and even in the lives of the people, your relatives back home and people you support back home. Because part of what someone was saying is that peer diaspora has fueled, you know, like certain types of behaviors back home. Hii kutuma sendwave kila saa na siku hizi Kenya kuna hizo ma Uber Eats na nini, so they're slowly catching up to those habits. Mtu akiwa anasikia njaa kidogo, you know, badala ingie jikoni apike, anaona sio Mosha anaweza kunitumia ka $20, ka $30. Na hiyo $20-30, there's so much that it can do.
Tuesdays and Thursdays, those calls come.
Yes, those calls start coming in.
Buy one, get one free. We know them.
Yeah. So
Chicken Tuesday.
Yeah.
Boss, let me...
Biryani Friday.
It's very sad. Very sad. Very sad.
Yeah. So I think people need to start being careful. And it's true. You know, like Kenya watu wamenona siku hizi. Zamani ulikuwa unaona yani watu walikuwa ni wembamba na nini. And the worst part is that nowadays, even kids, you know, like very young kids, unaona mtoto, you know, like
2 years old and they are overweight.
Yeah, and they're overweight, you know, like 3, 4, 5 years old. Yeah. So these are things that we never used to see. In fact, zamani ilikuwa unaonekana wewe ni mnene, it used to be associated with health because everybody was skinny na ilikuwa inakuwa assumed people are skinny because they are poor. Because wakona mashida nyingi. And people used to walk a lot. The other thing that I learned is that the normal, you know, like the human body was built to be walking at least 5 to 6 miles a day. And for the longest part, you know, like when people were hunters gatherers, or even when people were walking to, let's say, for example, from Kibera to industrial area for work, then unamona nakula, you know, like a big meal, that is okay because, you know, like they're spending those calories. But here life here, you're sitting in the office, even in the grocery store, you're going with a car, you know, like anything. Hata kwenda kutupa trash, you know, like I saw someone put the trash bag on the hood of a car, then ana drive pole anaenda anatupa trash and then anarudi.
Oh, sisi kazini kuna mmoja anakwenda kusmoke.
And I'm like,
anaenda na smoke alafu anarudi. Yeah.
Yes. So you see, so those are crazy things. So I think, Chrissy, we need another episode with you because there's still so much that has not been covered, and there's still so much of value that Kenyans can learn. And I think the biggest myth that we've been able to deconstruct, Miguna, like today, is the fact that The food that we have in Kenya is not as organic as we want to believe it is. It's not as bad as here, but we're heading in that direction. So you have to start thinking about where you source your food. Na kwa hayo machache, yote ambaye anataka kunipigia simu, nambari yangu bado ni ile ile, ni 1-800 mteule. Na pale utakishika simu, mwambie unataka kusema na mjukuu, na akikuuliza ni mjukuu yupi, mkumbushe ni mjukuu yule yule wa Masai, because I'm Kenyan by blood, American by design, Masai by choice. Sichagui, sikagui, na sibagui. Kwaherini.
All right, Christine, thank you very much. For the listeners and the viewers, thank you. Thank you for your comments. Thanks for listening. Thanks for chiming. Yeah, everything. Wacha na ujinga busara. Okay?
Mbona si busara ujinga?
No, ni ujinga busara. Yeah. So, haijalishi mnapendana kiasi gani, no matter how much you love each other, one thing you will never, ever be able to do is to bury each other. One mic. Shukran. Wengine wote tonana next ijayo.